Welcome to the UF Health, Heart, Vascular, and Neuro Hospital. This tower encompasses everything you will need for your upcoming surgery, including our OR, ICU, and step-down units. Our lab, radiology department, and clinics are also located in this building. All of the hospital rooms in this tower are private and have a couch that turns into a bed for a guest to stay with you. Visiting policy changes sometimes, so we will update you on the latest policies during your visit. During your stay, you will have multiple team members involved in your care, including physicians, physician assistants, nurse practitioners, registered nurses, respiratory therapists, physical therapists, and occupational therapists. Each member of the team has an important role in your care and recovery. Before your operation, there are some things you should be aware of. Medications such as over-the-counter herbal supplements and vitamins should be stopped 1 week prior to surgery. Blood thinners like Eliquis, Coumadin, Xarelto, and Plavix will need to be paused prior to surgery as well. If you are on any of these medications, please make sure your provider knows. Other medications, such as those for diabetes, high blood pressure, and other conditions, will also need to be reviewed. If you are a smoker, every attempt to stop prior to surgery will aid in breathing recovery, as well as incisional healing. We don't recommend resuming smoking on discharge. If you are diabetic, it is important to know that strict blood glucose control before and after surgery is very important for healing. On day 1, you will check into the admissions window on the first floor. You will be brought up to the second floor pre-op holding area where you will change into a gown and have your IV placed. A guest may accompany you and wait with you before you go back to the operating room. Once in the operating room, the anesthesiologist will give you medication that will put you to sleep. A breathing tube will be inserted into your trachea and you will be placed on a ventilator. A central venous line will be placed in the large vein of your neck to administer medications, and an arterial line will be placed in your wrist to monitor your blood pressure in real time. A urinary catheter will also be placed. After this preparation, your surgeon will complete your surgery. After surgery, a few drainage tubes will be placed to help remove any additional fluid from the chest. These tubes will remain in place until the drainage is minimal. Once the surgery is over, you will be brought into the Cardiac Intensive Care Unit, or the CICU, on the 7th floor of the hospital. The breathing tube will still be in place and you will still be asleep at this time. Once it is determined that you can safely have your breathing tube removed, our team will remove the tube and you will be more awake. The ICU is a busy place and several team members will be regularly monitoring you. Your nurse will be assigned only to you while you are waking up, providing one-on-one care and tending to your needs, such as monitoring blood pressure, heart rate, and pain control. You'll likely remain in the CICU for the first 2 or 3 days following surgery. During this time, we will work to control pain and will adjust medications for your heart rate and blood pressure and monitor your overall post-operative recovery. We will assist you in getting up and sitting on the edge of your bed very soon after the breathing tube is removed. Physical and occupational therapists will work with you daily to help you get out of bed, sit in a chair, and walk the halls. Nursing staff will work with you as well, removing some of the tubes and lines that you have as you progress and no longer need them. Following your recovery in the CICU, you'll be transitioned to what we call a step-down unit, where you will remain for the next 3 to 4 days. During this time, we will focus on transitioning all of your medications to oral form, which is how you will take them at home after discharge. We will also remove any remaining tubes and drains that may still be in place. You will be expected to get out of bed to take all of your meals in a chair. This helps improve your breathing and engages core muscles to build your strength. Your recovery team will visit in the mornings to update you on your progress and discuss the plan for the day. You will be expected to use your incentive spirometer 10 times every hour on your own, and a respiratory therapy team will provide additional support and breathing treatments as needed. We will monitor your intake of fluid and how much urine you produce. Bowel movements after surgery are very important. because anesthesia and pain medications slow down your GI tract and can cause constipation. For the 2 or 3 days before you check in for surgery, we recommend you eat soups, fruits, vegetables, and salads, avoiding meals heavy with carbs, meats, or cheeses to reduce post-surgical constipation. We will also give you stool softeners and laxatives to get things moving if needed. After you've made the progress necessary for discharge, you'll be ready to go home. You will have a follow-up appointment in our clinic 2 to 3 weeks after discharge. We will go over medications at that time, remove any sutures or staples, and discuss your recovery. We hope this video has been helpful in sharing what you should expect, but please always feel free to ask questions of your surgeon and surgery team. We are here to answer any questions you may have.